Hello everyone, this is my online course on Health Humanities, Indian and Western Knowledge Traditions. In this course, we will discuss about the intersection of health, well-being, humanities and social sciences. The relation between health, illness is very complex. It needs a lot of understanding through different disciplines. So in this course, we will focus on the relation between health and humanities. And to understand the relation between health and humanities, our concern is to see how humanities has been pivotal in the discipline of health and medical sciences. So in this regard, we will talk about the relation between humanities and health humanities, the key concerns of health humanities, the key concepts in health humanities, and the key disciplines which are involved in health humanities. And then finally, we'll talk about the role of health humanities and medical sciences and how they collaborate with different disciplines. Coming to the point of humanities and how they intersect with medical sciences. The question comes like, what does humanities contribute to medicinal sciences? How humanities affect, contribute, critique, and enable medical sciences? Then we need to understand the origin of the word humanities. And the word humanities has been derived from Latin, and which is humanitas. And then it goes back to Greek as well, where the word is philanthropia. And these two words, humanities, which means humanity. How does humanities have some concerns with humanity? And what are the contributions of humanity and humanities that go in making of medical sciences? And in this regard, we need to understand the concerns of sympathy, empathy, compassion, pity, concern, caring, which humanities provides to the medical sciences. And how then it is further taken by with the idea of philanthropy, something charity, something giving, something like accommodating other. And hence, humanities is a discipline which provides a human concern to the medical sciences. It provides different approaches of humanities and social sciences to look at medical sciences from a new perspective. And the question like when we think about the issues of joy, suffering, emotions, how do we understand these questions, these concepts? Where from we get the notions to understand these concepts? Then one has to look back humanities and social sciences. They provide the tools, the techniques to understand the emotions, the joy, the suffering of a person. Then the next question, like, how do we structure our life? Where from we get our motivations? Where from we make our life easy? Where do we find our role models? And the question again goes back to the humanities and social sciences. They make medical sciences enrich with the help of humanities. And in this regard, humanities plays a major crucial role in making of health humanities and in making of medical sciences. So health humanities is a recent discipline, focuses on the narratives of patients and their experiences, what they tell, what they narrate, what they experience, what they undergo. And it reproduces them with the help of narratives. And health humanities then also focuses on how illness and disability, trauma, and other kind of diseases have been represented. The illness is not just a bodily problem. Illness can be social, it can be cultural, it can be psychological, it can be biopsychological, it can be biopsychosocial. Hence, the representation of illness is not just limited to body, but it invites a large number of socio-historical, cultural, political contexts. And hence, understanding illness involves understanding a large number of contextual references. And hence, the representation of illness is not just a kind of monolithic neutral act. It can be reflected with different ideological biases. The task of health humanities is to critique these biases. The next point, how do we consider the issues of empathy and ethical care in medical sciences? The idea of empathy and medical care as well as ethical care, it comes from different modes of being which lies in literature and other cultures, and medical sciences adapt them to their own needs, to their own usage. And hence, the concerns of health humanities is body, identity, and social justice. It talks about how body and identity are necessary to understand illness, to understand one's disease. And illness is not just something which needs a medical cure, but at the same time it needs a social justice as well, because the medical facilities sometimes are divided across the lines of different norms, different parameters, different identities. So social justice and social equity are paramount to the concept of health humanities. Moving further, the concepts which I would focus in this lecture are health humanities. What does health humanities mean? Where from this domain emerges? What was the need of having health humanities? How it is different from other sciences? And the purpose is that health humanities takes into consideration the beliefs, values, points of view of the sufferer, the patient, the medical staffs, the nurses, which sometimes remain marginalized in other domains, who become sometimes secondary in other domains. So health humanities is a kind of interdisciplinary discipline which considers the roles of those who have been neglected, who have been marginalized in the intellectual knowledge traditions of medicine. And the similar concept which goes along with health humanities is medical humanities. However, the critics like Paul Crawford, he says that medical humanities are more focused on doctors, and it gives a little importance to the patients, to the other paramedical staffs. So doctors have supreme position and other people get marginal and secondary positions. Hence, medical humanities has been seen as something which is more doctor-centered, and health humanities is something which is contributing to the needs of everyone. It considers the identities of everyone. And then the concept of critical medical humanities comes. What is critical in medical humanities? Why it is called critical? The reason is that critical means to observe, to investigate, to judge something critically, to bring the methods, approaches from other disciplines such as gender studies, race studies, and other disciplines. So to evaluate something critically by bringing notions from different domains, from different disciplines. And in this way, it provides a new approach to the healthcare by intermingling humanities with healthcare. And one also needs to understand the key pillars of health humanities, such as ethics. Ethics is very necessary to not just health humanities but medical sciences as well, to other disciplines as well. It can be biomedical ethics, it can be medical ethics, it can be the ethics of patient towards the doctor, the ethics of doctor towards the patient. It can be the ethics of paramedical staffs. And then education, how one is aware about one's illness, how one has been informed about one's illness and disease. Empathy, how one gets treated. So these are the key pillars of health humanities. And then the issues of legality, consent, and morality further comes. Does patient gives his consent to the treatment which he is undergoing? Is there any kind of legal constraints? Has the issues of legal and individual consent been achieved? What are the moral disciplines? How does morality comes into existence? So these questions are further evaluated in the domain of health humanities. And finally, one has to understand the difference between illness and disease. However, I am using these two terms interchangeably, but the basic difference is that disease is a bodily problem and illness is something which has been imposed upon the person through the society. How the society considers a person who has been sick of particular disease, and then the identity which one is given. For example, when a person is having cancer and one calls this is a cancer patient, and he is looked as a cancer patient, and then the idea of reducing his entire identity to cancer is seen as illness, but the medical problem is disease. The key disciplines which have been involved, as I said earlier, that health humanity is an interdisciplinary field and it involves the intersection of literature. One has to use the competence, techniques, methods of literature, narrative studies to understand health and illness, to understand the relation between doctor and patient, to understand how one is seen and evaluated, judged and gazed upon. Hence, literature and narrative becomes a critical major tool in understanding health and illness. One has to also look upon the notions of history and philosophy. What history and philosophy contribute to the notions, to the idea of illness. Historically, certain illness have certain bases. They have been categorized in a particular way. Philosophically, one has certain reflections upon some illnesses in a particular point of time. One has to look at the historical conditions. One has to look at different conditions which formulate and construct illness. Then one has to move to the idea of ethics and theology. How does theology, how does religion consider illness? Sometimes religion considers illness as the punishment of the past. It is seen as someone's sin, and the contemporary illness is the result of one's sin. How does theology and religion provide cure? There are different methods which theology provides. Further, the notions of ethics are very necessary, that how one has to respond. And the study of illness and disease also involves the study of cultural methods and the methods of sociology. The methods which are the tools which one uses in the study of culture, society, the same thing can be used in the study of literature, in the study of illness, in the study of other disciplines. Hence, they have some kind of intersectionality. And sociology is very important. Sociology provides a key concept in understanding illness. It replicates illness in a particular social condition. Then one has to see how illness has been visualized and how visual and performing arts respond to illness. Further, one has to consider illness and disease based upon gender, caste, race studies. Sometimes the same illness can be treated differently, and one can get different medical facilities, being a male, being a female. So the discriminations which happens based upon gender, this is something one has to consider. The illness can also be considered at the level of poverty, how the rich and poor nations have access to health care, how rich and poor people have access to the health care, how those who are having all the facilities and those who have minimum bare facilities, and what facilities do they have. One has to study the data based upon poverty, based upon one's wealth, based upon the socio-economic divide, based upon the caste and gender issues. And when we think about the conditions of illness in colonial period, maybe in modern time as well, in contemporary times, we find that race is also crucial. How black people have access to the health, how white people have access to the health, and what are the resources available to them. So in this way, health, illness and disease, they have to be studied in relation to gender, caste and race studies. And this is why in health humanities is an interdisciplinary field. It involves all the disciplines, all the subjects in different manners, and each discipline can contribute to the understanding of health and illness. And coming further, we need to see what is the role played by humanities in medical sciences, how humanities contribute to the medical sciences. And one of the major contribution of humanities is to provide a new pedagogical approach to medical sciences. Medical sciences has to be studied from the tools, from the techniques derived from literature, from humanities, from social sciences. One has to bring the notions of critique, analysis, evaluation, and then apply it to medical sciences. One has to bring the tools of literature such as plot, such as narrative, such as characters, and then see how they can contribute to medical sciences. Hence, the pedagogical approaches of humanities play a crucial role in the development and study of medical sciences. It makes one understand that what happens to the persons in literature, and then through Aristotelian idea of pity and fear, it can provide a reflection upon the doctors, and then they can think and evaluate that what is happening to literature and something which is happening in a very fictional manner, but can become a tool to analyze this. And hence, literature provides a new tool to understand medical sciences. Further, a lot of literary texts have representations of illness and disease. They can be the books and maybe novels, drama, poems, short stories, going from ancient times and coming till modern age. Further, one has also to see how art functions as a medicine, how narrative provides some kind of therapeutic and healing approaches, applications. So, for example, like telling a story, or narrating one's experiences helps the person to understand what one has been going through. So narration, storytelling, as well as repetition of certain incidents provides one to rethink what has happened to one's life. It also makes them to order what their life has been. So art functions as a medicine, art functions as a healing. So healing is something which are very crucial form of art, and it can contribute to medical sciences in different ways, in different modes. And then one has to also see how medicine can be seen as an art, how medicine can be seen as a performance, how the advice of doctor to a patient is an art, how the treatment can be a kind of art and performance. And this is very crucial, that art can function as a medicine, as well as medicine can also function as an art. Here one has to understand that what tools, what resources one can derive from art and humanities, and then use them to the medical sciences. So medicine is an art. The treatment of a patient by a doctor is an art. The therapy is an art. The explanation of a disease to a patient is an art. Sometimes a person who has some kind of very serious disease, and he may not be able to cope up with the knowledge of disease immediately, and then how he or she has to be informed, that is an art. So medicine has to use the certain methods of art and then enrich its discipline. Health humanities is something which helps us to understand diverse human experiences by promoting intersectionality between different disciplines, different methods, different approaches, and it advocates equity, justice, care. Health humanities is something which is an interdisciplinary field, and it helps one to understand how health and literature, health and social sciences, health and medical sciences, they are interconnected. They are not separate. They are not independent. And it further emphasizes that one has to now look at literature from the point of view of medical sciences, and one has to understand the elements of medical sciences in literature, and then one has to see literary elements, artistic elements in medical sciences. And this is how we see most of the literary texts which abound literary and medical approaches together. For example, one of the most famous play by Shakespeare, Macbeth, it has an episode of madness, and where there is a doctor who says that the person who is suffering needs more divine care than medical care, and bringing the issues of religion, bringing the issues of divinity to the cure of a person. And hence, health humanity is an interdisciplinary field. And with this, I conclude. Thank you.